Hi guys, this is Dr. Akib, first ever with you, uploading this video upon the ameloblastoma, particularly for BDS final year students who are preparing for the exams. Now talking about ameloblastoma. It is the most common odontogenic neoplasm of oral cavity. Now what you remember is the most common odontogenic neoplasm of oral cavity. It is benign, locally aggressive tumor of odontogenic epithelium. It is derived from two English letters, amel meaning enamel and blastos meaning germ. Ameloblastoma was first described by Cusack in 1827. Now, what are the etiology of ameloblastoma? Exact etiology of ameloblastoma is not known. However, certain predisposing factors are there. It may be trauma, infection, previous inflammation, dietary factors, extraction of tooth sometimes even leads to ameloblastoma, or some viral infections also are responsible for the ameloblastoma. Now talking about pathogenesis of ameloblastoma, or how its development takes place. Ameloblastoma can be developed from disturbance of developing enamel organ. Either it can develop from cell residues of enamel organ, whether it may be the cell residues of dental lamina or Hartwig's epithelial root sheath, or it may be developed from reduced oral epithelium, basal cell layer of oral epithelium. It is the development of ameloblastoma. Now talking about some types of ameloblastoma. It may be ameloblastoma may be unicystic ameloblastoma, multicystic ameloblastoma, peripheral ameloblastoma, and malignant ameloblastoma. Now, what are the clinical features of ameloblastoma? First, we will see the incidence of ameloblastoma. Usually, it forms 1% of all the tumors of oral cavity, and we can elsewhere we can say it forms 18% of all odontogenic neoplasms of oral cavity. Now, what is the age limit of ameloblastoma? Usually, it occurs in the second to fifth decade of life, and mean age for ameloblastoma is 32 years. Now, talking about sex, it mainly affects males more commonly than females. Now, what is the site of ameloblastoma? Site of ameloblastoma, particularly most commonly, it affects mandible, 80%, and maxillary bone is also commonly affected, and extraosseous site of ameloblastoma is gingiva. Now, talking about what are the clinical presentation of ameloblastoma. Initially, it causes slow growing, painless, ovoid or fusiform growth with bony hard swelling of the jaw. What you remember from this point? Slow enlarging. That is, initially it enlarges slowly, very slowly, then painless and ovoid or fusiform, bony hard swelling of the jaw. Bony hard swelling of the jaw. Now, talking about second point. Now, second point, it often causes the expansion of the cortical palates. You know what cortical palates are? The alveolar bone of the jaw has two cortical palates, two corticals, and in between them is cancellous bone. It causes expansion and distortion of the cortical palates of bone. Sometimes pain, paresthesia can also occur due to ameloblastoma. And what is one of the clinical feature of ameloblastoma is the displacement of regional adjacent tooth may even take place due to the ameloblastoma. Most of the patients of ameloblastoma gives the history of the long history of presence of periapical abscess in the jaw. And what happens there? Ameloblastoma, it causes extreme thinning of the cortical palates of bone. It leads to the very thin covering of the cortical palates, which upon digital pressure cracks and giving a crackling sound, as same as that of eggshell. Now, pathological fractures are result from the ameloblastoma. These are the all some of the clinical features regarding the ameloblastoma.